Hi, and welcome to my video. Have you ever wondered if your dentist communicates with other healthcare workers? Is your dentist independent from healthcare workers present inside the hospital? Are they connected somehow? Well, let's see. In today's world of healthcare, a healthy smile goes beyond just brushing and flossing. Interprofessional dentistry is a collaborative approach to oral healthcare that involves dentists working together with other healthcare professionals. This type of teamwork allows for a more comprehensive and coordinated approach to patient care. This can lead to better overall health outcomes. Stick around to learn how interprofessional dentistry can benefit your smile and your well being. To learn more about interprofessional collaborations, we have interviewed professionals representing varying occupations to have an idea of their perspective on dentistry.
Good morning. My name is Batislaon. I'm 26 years of age. I live in Cagayan de Oro City, but I was born in Jolo and grew up in Zamboanga City. What is my understanding of the role of dentist in healthcare? For me, the role of the dentist is sa mga ngipon, like ikuan nila kung i-cater nila kung sa mga concerns sa patients, like mag-ibot or kanang naay mga something i-fix basta about sa ngipon. So have you previously collaborated with a dentist in patient management? As a medical technologist, wala. But naka-encounter ko mga patients because akong papa is a dentist. And what else? Have you collaborated with a dentist in other professional contexts? So far, wala po. How do you envision your profession collaborating with dentists in patient care? Ang patient care sa medical technologies o sa dentist, pareha-pareha ra gyud kay kuan man mi kanang cater me on patients which is need among care. Lahi-lahi lang siya nga field, but we treat patients the same. We treat patients with care in terms of kanang nay mga syringe, like paunsa ang paghandle sa ilaha sa mga bata, among pugnan kay para dili lihok. Same ra gyapon na sa mga dentist na nagyapon. Kung unsay ang medical ug dental is pareha-pareha ra siya pero lahi lang gid ang specialty. But in patient care management, pareho ra jud kanang i-cater nimo ilang needs, imuhang kanang i-address nimo unsa ilang mga concerns, tapos imong ikuan kung unsa imo ikatabang sa ilaha, kung unsa nga services ila pong gikuha sa imo, like sa amoa na part is kanang magpa-test sila sa ilang dugo kung unsa ilang mga kuan nya i-refer sa doctor pod ang results. So the same ra gyapon sa dentistry. So maora to siya, and thank you.
I'm Elaine Joy Butuan, 25 years old, currently living at Cagayan de Oro, working as a registered pharmacist. As a pharmacist, we usually compound and dispense medications that are written in a prescription by a licensed physician. We explain the use and dosage of medications to our patient in layman's terms so they could easily understand. For me, dentists are experts of dental and gum care. They diagnose and treat oral health conditions. I had collaborated with the dentist in patient management and in other professional contexts. Pharmacists usually prepare the after-treatment medications prescribed by a dentist, then dispense it to the patient. Medications includes antibiotics, analgesics, and sometimes gum vitamins. We explain the proper usage and dosage of a medications to the patient.
Hi, I am Lingual Cabalhog. I am 27 years old and I live in Lapu-Lapu I am a rad tech, and I mostly do the image productions within the hospital, such as X-rays, ultrasound, and CT scans and other specialized parts of image production. And so, first question is, what is your understanding of the role of dentist in healthcare? Well, as far as I can say, dentists are those who study dentistry. It is a branch of study in medicine which focuses on teeth, gums, and any oral parts of the body. And have you previously collaborated with the dentist in patient management? Well, I can say no, because I mostly do conventional type of x-rays, and dentistry usually or commonly uses a panoramic type of x-rays, which is really rare for us to use in the hospital. And the next question, have you collaborated with a dentist in other professional contexts? Well, in my experience, no, but I do think some of rad techs out there, or some of the workers out there with the same profession as me, may have experienced collaboration with dentists, because it usually connects with our field. So last question is, how do you envision your profession collaborating with dentists in patient care? Well, I must say it is highly possible and applicable, because as the advancement in technology is growing nowadays, it is easier to go hand in hand with my profession and dentistry. So we would be able to provide more viable options, and I think more possible benefits in patient care.
Hello and good morning. My name is Edelbais P. Mondihar. I am an education graduate and I live in Zamboanga City. I am a secondary education teacher and is currently in my recent years of teaching. Usually, I deal with students aged 14 to 18 years old, but during my field work, I have also taught and assisted in teaching kids younger than my usual students. My understanding of the role of dentists in healthcare is sila ang tig-help sa ato whenever we have problems with our teeth or any sakit nga mag-involve sa ato ang mouth. So far, since I am not in the healthcare department, I have not collaborated with a dentist. But in other professional contexts, I can say that I have collaborated with them. During my fieldwork, I experienced having dentists from the police department visiting our school, and they taught the younger students on how to properly brush their teeth. They also taught teachers how to continuously remind their students on how to take care of their teeth. And in the future, I can envision that we teachers could help or could be the greatest factor in informing our students on how to properly brush their teeth. And I think through this, sa prevention may nga part makatabang sa among students, especially sa parents, on how to educate their children in the importance of oral health care. That's all so far, and thank you for listening.
Interprofessional dentistry has been a remarkable blend of different aspects of science. We need to realize that the oral cavity and its surrounding structures that us dentists are specializing in is not an isolated body part. It is interconnected with the different systems we have in our body. Your mouth is like a window that offers us a peek into your overall health. Compare it to a foggy window that indicates that something's wrong inside us. Mouth ulcers, gum inflammations, or even dryness can signal underlying issues. Knowing that, it is imperative that in treating patients, we also have to consider the patient's overall health. Every symptom and or sign has its cause. The mouth is the entry point for much of what we consume. Poor oral health can allow harmful bacteria into the body, potentially impacting other systems. It may not have been completely emphasized in the videos, but those professions play a big part in diagnosing and treating patients. Medical technologists give us valuable information about the patient's general health, using this to make informed decisions about diagnosis and treatment plans. Radiologic technologists give us visual aids that help us diagnose and monitor dental diseases. Although my RadTech friend may have not been able to collaborate with a dentist, but the profession itself nonetheless is our everyday partner in treating patients. Pharmacists aid dentists by using their medication expertise to ensure safe and effective drug use during dental treatment, improving patient outcomes. And lastly, teachers. They typically don't directly assist dentists in diagnosing and treating patients. Their role lies in educating future dentists and potentially raising awareness of oral health in students. As you can observe, different professions plays their different role in dental treatment. Each of them have a contribution before, during, and after the said treatment. Imagine having no collaboration with a medical technologist, for example. Dental complications sure will be a frequent happening. We will not be able to know beforehand when a patient will have a bleeding disorder during oral surgery. Well, more can be said about the importance of this collaboration, but it is enough to say the least that interprofessional dentistry is a real and essential healthcare matter. With this in mind, it is our goal not just to treat the patient's oral health concern, but to also advise them along the way with their overall health concerns by referring them to other healthcare specialists, comprehensively giving notice to their general well being. Hence, the importance of interprofessional dentistry. That's all for today. Thank you for watching.